Oh, go ahead, ma'am.
Yeah. Good afternoon, everyone. Welcome to this FP Live session. I'm Dr. Poornima Mathur from Oasis Fertility, Vadodara. Today, we are going to talk about low ovarian reserve, the poor ovarian reserve, and what are the treatment options available. Like we've discussed this earlier as well. Ki ovarian reserve is so much hype. Every second lady, like of late in the OPDs, we've started seeing young girls, जो early 30s में है, or they are in their late 20s. They walk into our OPD and they have reports showing their AMH reports where they are very much concerned कि ma'am we have a low ovarian reserve. So let me first get into detail कि हमारा ovarian reserve है क्या. Now when we talk about the ovarian reserve, it's like we know that the pregnancy जो baby बनता है that forms from two gametes. One is the eggs from the lady and the sperms from the males. Now eggs, unlike sperms, they do not form new every month. You have a reserve, you have a stock, you're born with it. When you were conceived in your mother's womb, जब आप अपनी मम्मा के उसमें थे तब आपके eggs बन चुके थे. And once you attain your menarche, आपको periods आने start होते हैं, you start using these eggs because your reproductive system is planned to give you pregnancy. Now every month आप अपने eggs use कर रहे होंगे from that basket of eggs which God has given you. Now nature ideally wanted कि आपके जो eggs हैं they would be used in the reproductive age group 15 to 35 where you would not have any difficulties conceiving. 35 to 40 with a little bit of struggle, and around 45-50 जो menopausal age, and that is where our egg reserves exhaust. So obviously it's biology. It varies from person to person. Now the way nature destined everybody is not born with those set number of eggs. हो सकता है किसी को ज्यादा मिल गए, हो सकता है किसी को कम मिल गए हैं. जिसको ज्यादा मिल गए would have no troubles conceiving even at the age of 40. किसी के पास अगर egg reserves कम है, they might face difficulties in their earlier age, like in their early 30s or late 20s. So how do we know हमारा reserve क्या है? What exactly are we dealing with so that we can schedule? We prefer planning our lives. We prefer things when they are in our control. So now the egg reserves, जो ovarian reserve है, how do we get to know हमारा क्या है? That is can be assessed with various tests. Some clinically with the help of ultrasounds, and some with the help of a few blood tests. So clinically, one is we know that the age has an impact. So हमें पता है कि somebody at the age of 38 or 40, I'm not expecting a very good egg reserve. हमारा low egg reserve हो सकता है. And then we have the menstrual cycle characteristics कि अगर किसी की cycle से regular है कि regular है, these all would help us guide towards what are our ovarian reserve that we are dealing with. But the better two most commonly used reserve tests are the serum AMH and the AFC count on an ultrasound. Now the AMH test, the clinical जो हम blood test से पता चलता है, which is not dependent upon your cycle length, that gives us an idea about what is our egg pool that we are dealing with. And an ultrasound, which is done on the second day of your periods or the initial first 2-3 days, that tells us ki what are the egg reserves that are seen in the ovary. The clinician can actually diagnose it. The other tests are done, but not so routinely used. So now talking about AMH. Now AMH is a simple blood test जो आप normal अपना infection के लिए test कराते हैं, इतने test कराते हैं. You add an AMH to it and you get to know your fertility potential कि हमारा एक reserve किस में deal कर रहा है. So the levels can vary. If we have over like 4-5 के ऊपर है तो we are dealing with high, which can be PCOS, not always. Somewhere between 1.5 to 4 would be the normal range, and below that it will be normal, be lower side pay. Now something that is less than zero point 0.5 would be counted as very low AMH, and that is what we're talking about. If I have a low AMH, how do I proceed about it? Like where should I be concerned? What are my options? How do I proceed? So like of late, the way the trends are changing. Like remember 10-15 years back, we were dealing with how do we control population of India. Obviously, we're still struggling with it, but it's like the paradigm is shifting towards the epidemic of infertility, and it is not so soon. Like in next couple of years, like maximum 10-15 years, we would be including infertility in the national healthcare programs the way it has been on the rise. So the poor ovarian reserve, as per all the societies that deal with the reproductive treatment, the reproductive medicines, there are different criterias. Some of them saying कि okay, let's be a little more dynamic depending upon कि पहले हमारा response कैसा रहा है, उसके ऊपर we'll see. Or more objective, like let's see the age, let's see the AFC, the egg reserves that we are seeing, let's see the AMH. So now, when we talk about AMH, we are talking about a hormone which is secreted by the eggs in the ovary, which are at a particular stage of development, pre-antral and antral follicles, जो हमारे पास growth के लिए develop होते हैं. They are a predictor of the number of eggs that would be available in an ovarian stimulation cycle. So this AMH levels, they decline with age. Now, till the age of 35, the decline is a little more gradual. When it is beyond the age of 35, it is a little more steeper decline in AMH. Now, if I have to talk about low AMH, what if I have a low AMH? I come across with it. Now, first is, when do I get my AMH tested? So this is something I would advise every young girl. You are in your mid 20s or late 20s. Obviously, this is not the time that we focus on our family lives. हमारा focus होता है हमारे career के ऊपर and ये सब. But if you have things sorted out, you've planned your things, if you know what you're going to deal with, you can plan it out in advance so that we do not have any hassles later on in our life. So if you are in your mid 20s, we focused on a career. जैसे हम regular routine health checkup कराते हैं. We go for, okay, let me see how is my lipid profile doing, how are my sugars, how my thyroid. Why not include fertility in it? So if you visit your gynaec for an initial consultation to know when this is my plan, like I'm working for right now, I'm focused for next 10 years, I would be focusing on it, or maybe next 3 years, I would be planning my pregnancy, or next 10 years. So let me have a brief overview, like how is my health doing? How do I maintain अपनी health को मैं कैसे maintain करके रखूँ so that later on I don't have any hassles? And what is my fertility status right now? What is my potential? So simple blood test and a simple ultrasound can help the doctor to guide you regarding how to proceed. Now, let me first clear this myth. Now, poor AMH का मतलब हमारा ये नहीं कि हमारा AMH low है. That does not mean you cannot get pregnant right now. Low AMH का meaning है कि the egg reserves or the stock of eggs that you have in your ovary, that is limited. Now, if I am dealing with a lower egg reserve right now, like we are now mid 20s and you have a low egg reserve, so you know that if you do not take an action now and 10 years later at the age of 32, 33, when you want to plan your pregnancy, there is a high probability कि हमारे egg reserves deplete हो सकते हैं or we might have trouble conceiving then. If you're already married, settled, looking forward, कि okay, fine, ठीक है, sooner or later, maybe in a couple of years, I'm going to plan my pregnancy and my AMH is low right now. So that means if you postpone your plans to another 3 years, it would be beneficial if you prepone it if it is feasible, or else we can go for fertility freezing as well. The fertility preservation methods. So now, if I have a low egg reserve, one is the case scenario can be I am married, looking forward to pregnancy, not actively though. It's like I'm just got a pre-consultation, pre-conceptual counseling, and maybe I would look forward to pregnancy in a couple of years. The other one is I'm not married, I'm focused on my career, and I am dealing with low egg reserve. Third one is I am young. I have been trying to get pregnant and my egg reserves are low. I've tried different medicines. I've got taken medicines for ovulation induction, egg बनने के लिए medicines खाई at a local gynecologist, and it has not worked for me. The other one is if we are advanced age में and we are dealing with low fertility and we are looking forward to pregnancy. So one is if I have a low egg reserve, the case one, and I am married but not yet very keen on pregnancy and I have a low egg reserve. So in that case, our advice would be please go ahead, plan your pregnancy as soon as it is possible for you. And then it is because the low egg reserve means that 4 years later you might have a more lower egg count, you might have difficulty in pregnancy. But since you are young right now, you've not practically tried, our first advice would be please go ahead and plan for your pregnancy. And instead of waiting for entire 1 year, let's reevaluate you in 6 months of active trying for conception. The other one is a young girl who's actually has been diagnosed with low egg reserve, but she's not married, she's not settled, and she's not looking forward to pregnancy right now. So in that case, she can opt for fertility preservation because she knows that even if I am like my AMH is in the range of 0.6, 0.7, 0.8. So, and if I am going to plan my pregnancy 4 years later after finding the right person, so I might struggle with my eggs count that time. So if I have my eggs preserved right now, I would be in a safer zone. 4 or 5 years later, I can still try for natural conception. If it does not happen or my egg reserves have steeply decline, I can always come back and take my preserved eggs. The third one is when you're a young, less than 35-year-old lady, you've been trying for pregnancy, though not that actively that you've underwent interventions like IUI or IVF, and you've been diagnosed with low egg reserve. So in that case, we would appreciate कि हमारे पास क्योंकि egg reserves कम है, the moment we start taking fertility treatments, the rate of decline would little bit increase as compared to what it is going to happen naturally. So ours would be okay, fine. Let's consult the specialist. Let's take the treatment from a fertility center only, where you are thoroughly evaluated. Any corrections, anything that needs treatment is addressed to, and then the treatment approach is a little more aggressive. Okay, fine, chalo, let's get you pregnant as soon we can, so that the low egg reserves do not impact our pregnancy potential. Now, if somebody who's in the advanced stage and is dealing with low egg reserve has been trying for pregnancy, that is where we would say, okay, fine, since we know the age is not in our hands, so we need to, and there's no point waiting further, we need to actively get you pregnant by different methods. Now, of late, the people come to us saying, कि अगर हमारा egg reserve low है, does that always necessarily mean that we cannot have our own eggs? Do we go ahead with donor cycle only? Because they've been advised with donor cycle. So it is like we believe at Oasis, like we try our best to give your genetic baby if it is possible. So, in order to give you your biological child, if you have a low egg reserve, what are the different methods or options that are available जिससे हम आपका आउटकम improve कर सकते हैं, chances of you having your own child is significantly increased. So one is dual stimulation, second is embryo pooling, and third is the ovarian rejuvenation, the most talked about topic these days. So dual stimulation is what happens is if we take a call for going ahead with IVF, we say कि okay, the IVF में we give you injections, we make your eggs, and your eggs would be as much as your ovary can offer. If I have a good egg reserve, my ovary has a little more eggs to offer. If I have a low egg reserve, my ovary might offer a few number of eggs. For instance, instead of offering 7 to 8 eggs, my ovary has only 4 to offer in an IVF cycle. So what do I do is I want to be at par with my friend who has a good egg reserve. Is after one stimulation, I go ahead with the second stimulation. I increase the number of eggs from 4, I am into 8 eggs now. And that helps me be at par and get my pregnancy outcome the way I want it. The different protocols for the same, they have where we can actually stimulate you in a single menstrual cycle, or we can have two consecutive cycles using the luteal phase and the follicular phase. The different protocols, whichever works best for you, whichever, like as you're treating fertility specialist, whichever is most suitable for you would be applied for you. So now the other thing is embryo pooling. Now the what do we mean by embryo pooling is like this only. Ki I have a low egg reserve. I undergo IVF. I end up making only 1 or 2 embryos. You're pretty young. You're just 28. You have incidentally because of some ovarian surgery or some reasons you have an AMH of zero point 0.5 or zero point 0.4. So I decide and take a call for another IVF cycle where I pool my embryos, and now instead of 2 I have 4 or 5 embryos put. So now this takes care of my current pregnancy, this takes care of my future pregnancy if I want to go ahead with. So this relationship between the number of eggs in live birth across the female age group, that suggests that the number of eggs, that's a number of eggs that are retrieved in an IVF cycle, is a very robust surrogate outcome for clinical success. So, if we have low number of eggs, the number of the live birth rate actually reduces. But by embryo pooling, we can actually improve our outcome. Creation of 5 to 6 blastocysts will maximize your per cycle live birth rate. Now, the other thing that is the ovarian rejuvenation. Now, what is ovarian rejuvenation? We've talked about, we've seen people. Rejuvenation means the act of giving new energy or new vigor. Now, ovarian rejuvenation means reawakening of the quiescent primordial follicles, which could potentially contribute to a higher yield and better quality of oocytes. So, where I said when we are talking about the AMH and everything, we are talking about a particular stage of eggs that are the pre-antral and the antral follicles. There are certain eggs which are quiescent and they would not be used. So, out of the millions of eggs that have been there in a girl's womb, the ovaries, Around 400 eggs are ovulated during the entire reproductive age group. If by some means the quiescent eggs can be mobilized into the active pre-antral pool, we can actually contribute to a higher yield of the eggs. So this can be achieved by ovarian rejuvenation. So now this ovarian rejuvenation has been in market for quite some time, but it is people are still studying it. Certain studies have shown advantages, certain studies have not. With our personal experience, have seen some better improvement in the quality of the eggs. So we've heard about platelet-rich plasma, where we take your blood sample, process it, collect the supernatant plasma, which is rich in growth factors, which goes to the entire body, collect it, and under anesthesia, without any major surgery, it can be instilled transvaginally or through laparoscopy into the oocytes. The other method is like that this PRP may assist in tissue regeneration, enhancement of anabolic signaling pathways, cell differentiation and proliferation and angiogenesis. And eventually, there's an international study which shows that there has been a significant improvement of the number of mature oocytes. We're talking about the those having low egg reserves and the quality of oocytes as well. So now the marrow derived stem cells. This sounds a little more invasive, but it has shown a very good success rate. These stem cells are a type of cells which have the capability of maturing into different cell lineages. They have the potential of renewing themselves and differentiating into different tissue cells. Now, these stem cells are collected from the bone marrow, that is the bone's a center major space. So, yeah, that is the bone marrow where we have these stem cells. Now, they are collected using a needle, and these are then injected directly into the ovary or your blood vessels where they reach the ovary. Now, there is a different phenomena. There is a homoning phenomena where the bone marrow derived stem cells directly and impulsively they migrate to the defective microenvironment. So wherever they find there is some defect happening, the stem cells would deliberately move there and they would try to repair the situation over there with multiple factors. So where if the ovaries damaged for some reasons are ovary, because when we're talking about low egg reserve, it is something that we are not anticipating. Somebody at the age of 45 comes with a very low egg reserve, so there the rejuvenation is not going to help because that is the more natural course of action. We're talking about somebody at the age of 30, 35, or 37. We're not expecting somebody to land with an AMH of zero point 0.3, zero point 0.4. They come to us. So we're trying to repair their ovaries. So all there have been different international studies where the effects of intraovarian injection of PRPs or stem cells has been studied and shown good response. So there have been various studies conducted. Now, in one study, 47% of poor ovarian reserve they had spontaneous pregnancy in response to PRP. The success of ovarian rejuvenation that varies from 35 to 75%, and the most important parameter that affects is the age, being a very important determining factor. So when we are looking forward to ovarian rejuvenation, it is not going to suddenly make your AMH from zero point 0.4 to 4. They're saying, okay, fine, if there are two eggs available in my ovary right now, the ovarian rejuvenation might help me get 3 or 4 eggs, or the quality of my eggs might improve, or the hormones. See, for instance, it is like I don't want pregnancy. My egg results are very low. I'm just 32 or 33, and I'm looking forward to if my eggs are depleting so soon. What if I hit menopause at the age of 35, 37? And that is going to have major hormonal changes in my body which are not desired at this age. So in that case, ovarian rejuvenation actually helps you maintain your hormones and might delay your menopause so that you don't have to rely on your medicines or hormonal supplements to maintain your health. So the crux is like low egg reserve, do not worry. Get your fertility tested. If you are a young girl, if you're focused on career or not focused or focused on pregnancy, whatever we are looking forward to, we have a routine health checkup. Let's include fertility in our routine health checkup. Let's assess our fertility. Let's be in charge of our life. Let's plan our things. Follow a proper diet, maintain a healthy weight, exercise regularly, avoid processed food, avoid alcohol, coffee, stress, and always believe in yourself. Whatever happens, we are there to help you out, to manage your low egg reserves, to preserve your fertility, to give you a baby of your own biology. Oasis Fertility has all the recent techniques and the advanced technologies to help you achieve your dream the way you want and whenever you want. Thank you so much. Any questions? We just mentioned that. How can I check my ovarian reserve? So if it is by a simple blood test like serum AMH, which is not dependent on the day of your periods, or a simple gynec visit where an ultrasound around the second, third day of your periods can help you guide towards your ovarian reserve. So if you have your friends, your sisters, or you yourself are there, so please include this in the routine health checkup. Any other questions? The poor egg quality would actually depend upon what is the cause. The egg quality per se. Now, when the eggs come, they have they can have different effects on them. Now, the poor egg quality can be because of the medical comorbidities that you have associated. Say, for instance, you have a diabetes which is not under control. If you are obese, if your age is your age, smoking, drinking, any pelvic infections that you've had, abdominal tuberculosis you have, so these are the factors that would actually lead to a poor air quality. So now the treatment for poor air qualities, one is the most important and the most underestimated thing is the lifestyle changes. So if we are overweight, we try to get our weight in control. We quit smoking, we quit drinking, try to maintain a healthy antioxidant rich diet, treatment of any infections that we have any. And it has been studied that the ovarian PRP and ovarian stem cells have actually given a better result regarding the air quality as well. But it is like too early to say it with conviction or make it as a guideline that it would help. Still, people are trying in, but of late, many studies have shown to have a good air quality with ovarian rejuvenation techniques as well. The other injections can also be included, like use of growth hormones and growth factors, that also improves the air quality. I think that's it for the day. If you have any queries, you want to know something about the fertility testing, preservation, or how to go ahead with ovarian rejuvenation, please feel free to call on the helpline number. This is Dr. Poornima Mathur from Oasis Fertility. Thank you so much.